Hello everyone, my name is Vishwa and today in this video I am going to give you a brief on what is ACA syndrome, that is anterior cerebral artery syndrome. So mainly stroke occurs when there is sudden loss of neurological function due to the interruption of the blood to the brain. It can be either due to any occlusion or it can be hemorrhagic stroke, but most of the times the cause of the stroke is ischemic. So now the brain is supplied mainly by the internal carotid artery. The internal carotid artery is further divided into the anterior cerebral artery, the middle cerebral artery and the posterior cerebral artery. Now talking about the ACA syndrome, when there is affection in the anterior cerebral artery, it mainly affects these areas because the anterior cerebral artery supplies the medial aspect of the cerebral hemisphere, that is the frontal and the parietal lobes. It also supplies the subcortical structures, that is the basal ganglia, the anterior fornix and the corpus callosum. When the anterior artery is affected, when the anterior cerebral artery is affected, following signs and symptoms occur in the patient's body. So first of all, there is contralateral hemiparesis. That means one side of the body is having weakness as compared to the other side, in which specifically the lower limbs are affected more as compared to upper limb. The reason being that the anterior cerebral artery supplies the medial aspect of cerebral hemisphere. This medial aspect of cerebral hemisphere mainly contains the functional areas of all the lower limbs. It includes the functional areas of all the lower extremities. So the lower limb is affected more in anterior cerebral artery as compared to the upper limb. It also has the contralateral hemisensory loss, which means that the sensations on the affected side are less as compared to the non-affected side. Then there is urinary incontinence, which means the patient is unable to hold the urine. Then there is apraxia, which means that the patient is having difficulty in performing any skillful movements. Then there is abulia or akinetic mutism, in which the patient's behavior becomes less active. They are being less involved in a different form of activities. Then there is also presence of contralateral Brass reflex and the sucking reflex. So this was all about the ACA syndrome. Thank you.